Good morning. Pat Zemer here, CEO of Magna Wave. Welcome to Tuesday morning office hours. Every Tuesday morning I come together with you at 9 o'clock Eastern Time to answer questions that I've received over the last week and answer any questions or have any discussion that you'd like to have or discuss at this time. So I'm glad to be here, and I look forward to having a good conversation this morning. I've got some good questions that are ready, some good comments that have been made, so we're here to do that. If you'd like to call in and have a discussion with me, the number is 502-599-9722. 502-599-9722. Mute your speakers if you do that, and that way you won't have any feedback or echoing going on. So again, that's the number. If you'd like to join me on screen, on camera, Skype, P. Zemer. So go to your Skype account and give me a Skype, and we'll go from there. We'll see what you have to say and answer your questions, whatever you may have. So glad to be here. So let me pull up and take a look here at some things that have been going on as far as questions are concerned. And the first question is, let's see. Oh, that's not the right ones. Let's come up here. Here we go. I got them up now. I had the wrong date up. The question is, I know Magna Wave speeds up absorption. Are we okay to Magna Wave horses on Previcox, Butte, etc.? Also, what about penicillin? I suppose the better question is, what medications should not be given at the same time of Magna Wave sessions? Well, what Magna Wave does is it improves the metabolization. It doesn't necessarily speed up the absorption, although I guess if we increase the metabolization, it's basically going to potentially go to work more quickly, which could be termed as speeding up the absorption if you wanted to look at it like that. And so, yes, it does enhance the absorption. For example, a lot of times when they make medications, they assume that when it's taken and ingested, you might get 20% of it into the system before it's passed or before it's broken down in the body or in the stomach. And so you know that you're going to get this percentage of it. That's how they figure that you're going to absorb so much of a drug, of an aspirin or whatever. And what Magna Wave may do is make it so instead of 20%, just picking a number, you might get 30% and of a particular medication or particular protein that you're taking or a supplement, whatever it may be. So for that reason, you can do it, but for that reason, we suggest that if they're going to give a medication or if you're going to take something that can be enhanced, wait for it to be digested. In other words, let them give the medication, wait an hour for it to be absorbed into the body, and then go treat, because it's already in the system. You're not going to change the amount in the system. We've had that question before with regard to testing, where they test how much of something is in the blood. And for as far as testing for horse competition or even human competition, whatever it may be. Well, once it's ingested and it's in the blood, you're not going to change the amount that's in the blood or in the system. And so you might improve how it's working in the system with improved blood flow, improved oxygenation, that type of thing, how the body overall is reacting. But it doesn't mean that it's going to change the percentage of something that's in the system unless you were to do it at the same time as you're giving something, a sedative, for example. If you want to relax or they say, if we used to talk about if people had a glass of wine, if you're drinking wine and treating yourself, you're actually enhancing the amount of alcohol that will get into your system from the wine. So again, what we recommend is that you administer the drug, let the drug go, then do the treatment. So it's not unsafe to use Magna Wave with any of these medications that were discussed. It's just a matter of when you do it around the time that the medication is administered. Okay, any other questions? Just put them in the chat box here on the page, and I'd be happy to answer them at that point. We typically, and as I said, we talk about how long should you wait. In many cases, and I want to come back to this because I was looking at my notes, as long as it's a few hours or an hour or so after something is administered. In some cases, if they're doing antibiotics, we've had people that have said, well, I've got an infection and I'm going to give some antibiotics. How long should I wait? Let the antibiotics do their job. Antibiotics do their job. We'd say wait 24 hours. Let them do their job. Let them get into the system and go from there, and then begin your treatment. Okay, and then the next question that I received, what about treating someone receiving chemo? The question was that I was asked yesterday, can you treat someone receiving chemo? Where the same thing comes into play. If someone is actively receiving chemotherapy and they're taking the medication, or the medication is being administered to them at that point, and by increasing the metabolization, so people sometimes become sick if they're on chemotherapy because of the poison that they're basically putting into the system to hopefully kill the tumor or kill the cancer cells that are in there. We don't want to enhance that. We don't want to have that. We don't want anybody to be sicker. So what we recommend, if someone is on chemotherapy and then they'd like to use the therapy for whatever reason, pain or anything after, we wait for the chemotherapy to be completed. Give it a day or so to get out, to be fully out or fully free in the system, so it's not going to be enhanced from the use of the therapy, and then begin to treat. Many times people receive a 2-week regimen or a week-long regimen, and they're off a week or two, then they come back and get it again, and we've had people use the therapy between treatments for pain, for whatever the situation may be. So that's the recommendation when we're talking about someone with receiving chemotherapy. And that's always something to keep in mind. Now, radiation is a different story, because it's radiation being administered right at it. Once that's complete, the process is complete. If someone wants to, again, talk about pain relief and so forth, relaxation, being able to sleep, then you could begin and use the MagnaWave accordingly for what you're looking to accomplish. Let's see here. Let me pull this question up here. We do have a question. Let's see here. Oh, let me get rid of this Skype thing here so we can do that. All right. Pricing. Would love to be able to do treatments locally, but we didn't get the whole question. Miranda Miller would love to be able to do treatments locally. Well, and I think she's asking what pricing would be, how much someone would charge for a particular service or whatever with the machine. Well, you'll find that in the horse world, the prices range anywhere, I would say, from $85 to $100, $125, sometimes maybe even $75. Now, it varies. It varies on what the area that you're in, what the predominant price is. But I would say that's a good average on what pricing costs or what pricing is on the machines. She did come back. I do have I'll come back to that question in a second, but that's pretty much the pricing range. On the human side or the small animal side, a lot of times you'll see pricing for a 12 to 15 minute session in the $35 to $45 range, or however long they're treating the person, but that's kind of where it is on an entry level for human application. Now, if you're treating somebody for a full hour and much likely to be getting a massage, then again the pricing may go up to $75, $80, depending on what the time consumed and how much active hands-on is required for the treatment at that point. Okay, let's see. Here's another question. Let's take a look here. Muscle tear effectiveness, bone fractures, and arthritis. Great questions, Miranda. Muscle tear effectiveness. What this therapy does is it improves the oxygenation in the blood, and it improves the blood flow. and basically setting the body up to be in a position to better heal itself. So when you have torn muscle, you want to get good oxygen to the area of the tear so it can begin mending and healing. You want good blood flow through the area so it's healthy. And so what you want is to basically, a lot of times the thing that slows down or gets in the way of the healing process is inflammation. And so if we can get rid of the inflammation, again, it sets the body up to better heal itself and be better receptive for any medication that's being used, any dressing that's applied, or anything like that. So muscle tear effectiveness, I've used it. We've had people using it on ACL, MCL pulls and tears, a lot of tendon issues in the horses, plantar fasciitis in people. So just it's excellent for that type of thing. Bone fractures, the modality is actually FDA approved for use with non-union fractures, and it really does seem to serve to speed up the healing by a third or a half. So to heal more rapidly and to heal strongly. So it's very effective for bone fractures, and certainly arthritis. You have a buildup of calcium, the nerves and the tendon and the cartilage become irritated by that, and you get inflammation as you have more buildup of calcium in the area, and inflammation is where the pain comes from in arthritis. So if you can get rid of that, it's very effective, and it can help slow down the buildup of the calcification. It will help with the inflammation reduction to relieve the pain associated with arthritis. And so to answer all three of those, it has shown to be very effective in relieving pain in those types of areas for small animals, for people, for large animals, cattle, horses, the whole 9 yards in that perspective. So great question, Miranda. Thanks for asking. If we can answer more questions, please just let us know. Really appreciate when someone asks those types of questions. So let me take a look here. Another question that I received was asking about, will it work with PSSM in horses? And basically PSSM is polysaccharide storage myopathy. It's where you get it affects, it's a muscle disease that occurs primarily in quarter horses, paint horses, and Appaloosas. Polysaccharide storage also occurs less frequently in breeds such as drafts, cross breeds, and warm bloods. The clinical sign of the disease is more like a cramping or tying up in a horse. So cramping is just because of what's going on. You want to relieve that. You want to have good blood flow around it. You want to have good oxygenation to the area. If there is inflammation in the area of the tying up, you want to release and calm the muscle areas. So it can be diet and exercise is key when you start talking about that type of indication. So if exercise is good, if we're going to exercise the cells of the body and exercise the muscle fibers around the area that they're having issues, that's very beneficial. So with regard to PSSM, is it going to reverse it? Is it going to be the end all? No, but can it be an aid to the medication they're taking, to the diet and exercise? For sure. So that's one of the questions with regard to PSSM. Oh my, there's a long question. Let me pull that up here and let me pull that up and we'll take a look at it here. All right, good morning. Good morning, Karen. I've been treating a Ford that fractured his pelvis and fibula January of 2017. For the past 6 to 8 months, the owners have been having to assist him getting up after he lays down. It takes him about 45 minutes to get back up. Vets have told the owners to put the horse down. He's had 4 Magna Wave treatments and has not needed assistance to get up. Great results. I'm treating him twice a week, but he's still lame on his left hip. I'd like to focus more tonight on the left hip. How much time can I spend in a specific area like that? Great question, Karen. Let me get this taken care of here so I can. There we go. So I can move that out of the way. There we go. Took up the whole screen. Well, the question is, how much can you work on that area? I would say comfortably, when you've got a situation like that, let's call it chronic, let's call it acute at this point still, you could spend easily 15, 20 minutes on the hip area of the horse. You're not going to overdo it. Do you need to spend an hour? No. Anything more than 15 or 20 minutes on an area like that you really want to get to is plenty. Anything more than that is simply overkill. Now, could you come back and do it twice in a day? Could you do it this morning, wait 4 to 6 hours, do it again? That could be very beneficial to approach it like that, to do it multiple days in a row. A lot of times when you have situations like that, I mean, this is an injury that goes back some time, and so it's had a lot of time to get in the way and cause problems, and you're not going to relieve it right away. Now, obviously the horse feels better, feels like it can get up more easily without the assistance that's required, but to get down deeply into the hip area could take a long time, because you don't know what, when you have inflammation in cartilage and tendon and nerve areas, it's harder to get the inflammation out of those areas, because they're not like soft tissue muscle to where there's obviously blood right there, but when you get into these other areas, they're nourished by the blood, but they don't have the blood flow obviously right through it. And so you want to get into those areas and work them diligently, and it can take some time. It just takes more to get inflammation out of a nerve or cartilage or tendon than it does out of the soft tissue itself. So it could take some time. I've often told the story about my wife. It really, she had herniated discs and couldn't raise her arm and was in constant pain. It really took us about 90 days of treatments to get her to the point that where she feels good for 4 weeks at a pop. Then 2 or 3 more treatments, she's good for 4 weeks. And so, we just worked our way to that time frame, and you may have the same thing on this horse. I'm not saying it's going to be 90 days, but I am saying it could take some time to get that hip exactly where you'd like to get it, so you have the horse feeling the way you'd like it to feel. And that's the same, like I just said, whether it's a small animal or a large animal or whatever. Let's see here. Let me bring this back up. How do they compare to? Magna Wave. How does Magna Wave compare to the Theraplate? Well, great question again. Theraplate, for those of you who are not familiar with it, most of you probably are, is a vibration platform. The person would stand on the platform and hold on to the side, and then it would vibrate from your feet, and you feel it all the way up through your body. The same thing if you have a horse or a small animal, they stand on the plate vibrates, circulation is moved up through the body. Basically what's happening there, as I just described, the Theraplate helps enhance the circulation with vibration. Magna Wave, on the other hand, actually penetrates the blood cells, allows the blood cell itself to take on more of the available oxygen to it, so it increases the oxygen uptake to the blood cell, which then serves to reduce inflammation. Will circulation help reduce inflammation? Sure, but you have 2 different modalities in how you're doing it. Theraplate, a lot of people love it. It works very well. It does aid in circulation. It does aid in relaxation of the animal, but if you really want to get deep into that hip area or get deep into a shoulder, and the Theraplate's going to vibrate the hips and going to help that. But if you want to get deep into the hip and get down in there to where there's an issue, the Magna Wave type of PEMF will certainly do that, and again increase the oxygenation in the blood, which is going to serve to reduce the inflammation. Using them together, I've got horse trainers. Joe Sharp is one who's got several of our machines, a very successful horse trainer here in Kentucky. He has a Theraplate. He'll stand the horses on the Theraplate, and then he works them with PEMF, or he'll do the PEMF and then put them on the Theraplate. Complementary therapies, I think, are wonderful. I've never been one to say, oh, you're going to Magna Wave, don't laser. you may not need the laser as much, but doesn't mean that a laser, when used in conjunction, or an ultrasound in conjunction, or a massage in conjunction with the MagnaWave, or a chiropractic adjustment in association, can be very effective, and the complementary methods to bring them together is really, in many cases, where it's at as to how things can work out very well. Great question, Miranda. Thank you. Any other questions, folks? Let me know. Put them up there, and I'd be happy to answer them. I appreciate the likes. Share this if you would, so maybe your friends can see it and join us, and if they have any questions. Again, if you'd like to join me, you can call 502-599-9722. Be sure to mute your speakers. Or if you'd like to join me on Skype, simply go to Skype, and I'm P. Ziemer, P-Z-I-E-M-E-R on Skype, and then we can come on and we can visit at that point in time. So let's see. There was another question that I received. Oh, let's see. Here's another question from Miranda. Let's bring it up here. Is there funding available to purchase your own MagnaWave? We have banks that we work with, Miranda, and other forms of financing. You can call us here at the office. We're happy to go over your situation and talk to you about what you're doing. And if there's ways we can help you obtain financing, we can certainly talk with you about that and do that. We want to make it available to whomever would like to get involved in the best way possible. So great questions, Miranda. Thank you. Let's see. Another question here. Let's bring this up. Is there a difference between the equine equipment and the human equipment? The answer to the therapy, what's delivered to the body, there is no difference. The equine devices are made more durable. I mean, they're in carts and they have wheels and so on and so forth. The human side of the machines that many people use are more desktop-like machines, look like a computer or whatever type of device, but they're the same device just in different cases. The coils are virtually the same from the human to the animal devices. Typically, people who treat animals want longer leads on their coils. Many people who use them for humans, longer lead, they prefer the longer leads, but the coils will work on a person as well as they'll work on a small animal or a horse. So to answer your question, the equipment is the same. The therapy is the same. A cell is a cell. Blood is blood. How we can enhance what it does to the body just flows right on through whichever it is. All right, let's see. Great question, Arthur. Thanks for asking. Let me take this down here and go to the next one. Tracy asks a question. What is the benefit of MagnaWave with congestive heart failure? Great question. As you know, from the practitioner side of the house, we don't really treat specific conditions. A doctor, if we had a doctor that is with us this morning to want to approach that from the specific condition, they could address that. From my perspective, when you have heart failure, you have circulation issues, you have blood flow issues, you have stress that causes issues with the heart. So could better oxygenation, better blood flow keep the heart healthier longer? And I think it could help keep the whole body healthier longer. So again, and many times, Tracy, when you're talking about various conditions, it depends how far along it is. I mean, if your knuckle with arthritis, it looks like a baseball on your knuckle, you're not going to make that go away. But if you can start treating it early enough, then it won't get to the size to where it's that much of a problem. And so that's the important thing there. When you get to work on a condition or an issue, when you work with someone, does that help them? I know that, for example, the sooner you get to an injury with better oxygenation and better blood flow, the less inflammation you have, the less pain you have, things are more effective. So on the athletic side, when we treat racehorses or performance dogs or athletes, if they have a strain, the quicker we can get after it with good rejuvenation tactics, then it speeds up the healing, and it maybe doesn't get as bad. A lot of, as I said earlier, a lot of conditions, you'll strain something and you'll get a lot of inflammation, and the inflammation becomes as much as a problem as of anything else. You got to get rid of the inflammation in order to let things get back to normal. A knee replacement, for example, a lot of inflammation with a knee replacement. They go through a lot of therapy, but getting rid of the inflammation is part of the process that they go through. If you can speed that inflammation reduction and help have more flexibility in that knee or hip or whatever it may be, you'll get a better result in the long run. And so speed of getting after it. Could this be beneficial for someone with that type of condition? Certainly could be beneficial to the body, but again, it's when and how you're able to do it. Let's see. Let me see here. I've got another question. Okay, here's Laura asks. Let me move Tracy's question here. Laura asks a question. I am finding that sometimes when I pulse, my pointer finger gets sore. Is it possible that I'm getting too much on my hand? No, I wouldn't say that you're necessarily getting too much on your hand if you're, but you could have something going on there that you're working on. And that's a very good question. You can't really overdo it when you're talking about that. Is 15 minutes ample? As the discussion I'm having, but now you as a practitioner may be going all day long. It could be the way you're holding your coil that could cause the problem. I mean, if you need to, the ergonomic situation, how you're holding it, that could be the issue more than anything else that's going on. But that, give me a call and let's talk about that further. But that should not be any issue that you're holding it. I would think it could be the weight of the coil, how you're holding the coil, that whole type of thing. But being in the proximity with your hand I would not think would be an issue. Great question though, Laura. If you'd like to talk further, give me a shout. All right, let's see here. Here we go. Next question. I used the equine package and didn't get much response in my body. Well, it depends what you're doing. I don't know which machine you have, Amber, that you're talking about. But here's the deal: if someone's healthy, for example, if you go Magna Wave a child, you won't get nearly the movement because they're healthy, because they don't have stress in their muscles, they don't have stress in their body, and so you won't get as much movement. And it depends which coil you're using, it depends which strength you're using the machine, and which machine you're actually using. So that, not knowing what you have is what we need to deal with, or what issue you're trying to deal with there specifically. So Amber, tell me a little bit about what's going on. Perhaps you want to give me a call and we can discuss it, so we can make sure to get full clarity on the question that you're asking. Thank you, Amber. Let's see. Okay, Karen's back. Let's see what we got here. My equine vet is on board with PEMF, but my client's vet is not, to the point she shut the door to any veterinarian care for her horse. Have you run into vets that have pushed back on PEMF? How would you respond to them? Great question. So let me make sure I got it correct here. My equine vet's on board, so the vet that you're working with or a vet that you know, but my client's vet is not. So we have two vets here in play, to a point that she shut the door on any veterinarian care for her horse. Are you talking about your veterinarians who's backing you care for her horse? Have you had vets that push back on PEMF? We have had vets, certainly, that push back on PEMF. And how would you respond to them? Great question. Let's talk about that a little bit. In the beginning, going back several years, and people have asked about, and that's something that perhaps if we have time we'll talk about a little bit, but how MagnaWave got started and what was the progression. But in the beginning, when I started, the vets kind of thought, and people kind of thought I'm crazy, dragging this box around, doing these treatments, and then they started seeing it working, and they thought it was voodoo. It's really not doing anything. Then they started seeing it working, and they thought, it's working, but it must be illegal, or it can't be doing it right. And then the more it went and the more accepted it became, the more their customers wanted it, that the vets started saying, you know what, this is something that's working. Then the question becomes the type of practice that the veterinarian has. Some veterinarians don't get into massage. They let other people do massage. But some veterinarians feel like that might feel that something, whether no matter what modality it might be, is hocus pocus in their mind, so they think, well, don't use that because it won't work. For example, we had that with colic. When you talk about horses and with colic, and so they get the condition, and we didn't do it, and vets said, oh no, you can't do it. And finally one day somebody had a horse that was about to die, and they called their vet and said, can I MagnaWave it? And the vet said, well, we're going to put it down tomorrow anyway, or we're going to put it down today. Go ahead, try it out, I don't care. And it worked. The horse stood up, the horse released what was blockage, and bingo, things were good. So all of a sudden, that story started getting out, and people started calling and talking about it. Now, when you get into colic situations, unless it's constricted or knotted or whatever you want to call it, then you could potentially, a vet may decide that let's do this. But if surgery is required, surgery is required. You're not going to reverse the need for surgery. But yes, there have been people that have pushed back. What I would say is we have all kinds of literature. There's 1 million testimonials on our website. We have videos that can explain it and show it. And again, we have studies that have been completed with our equipment, not studies that have been done over the years with all types of equipment. We have studies that have been performed with MagnaWave devices that we can show the results and show what it does. It just takes a little time to educate these folks and get them to fully understand. Sometimes people are threatened. The veterinarian may think, or whoever it may be, that the massage therapist may think, or the acupuncturist may think, oh my gosh, this is competition for my business. I don't want people doing that. I want them to stay with me. So that's the challenge. But we have all kinds. We have the newspapers that can explain everything, and they can show what it does. But really, you're not going to change somebody necessarily. If that's how this vet feels, that's how they feel. Just tell the customer, whatever you think, if that's what you want to do. If you have any questions, I'd be happy to answer them, and let the good results drive it. And what I mean by that is the reason we're having this conversation today, the reason I'm here to answer questions, is because in 2006 and 2007, I'll go back to 2002 when I started doing PEMF therapy, but in 2006, 2007, when I started with this machine and I started with the high power therapy, it worked. I would treat horses and people would get on them and they'd ride them and they'd come back and say, golly, this is wonderful. I'd treat someone's back and they'd stand up and they'd say, oh, I feel so limber, I can ride again, I can do this or do that, or my shoulder is better. My wife's back. We got into this business because my wife's back injury, and she sat down for 8 minutes and she had no pain and total mobility. It didn't last very long, but that's why we had to do multiple treatments to get it where it lasts longer, now 4 weeks at a pop, and for the last 12 years. She gets 4 weeks worth of relief out of 2 treatments. And the more she does it, the longer it goes. But at any rate, you're not going to change somebody's mind. But the fact that it works will change their mind. They'll see it. They'll be at a show somewhere along the line, and somebody's going to say, hey, this is going to happen, and look what happened. And that's what happened to us. Trainers started telling their vets, I'm going to do this. This is working. We need to figure out how to work this into our treatment regimen. And the vets started saying, okay, let's look at it. Same thing on the human side. People start to see it working. Docs start talking about it. I've been amazed recently when people, one of our practitioners is having a knee replacement or hip replacement this weekend. Jason is, and he's talked to his doc, and his doc's on board and says, yes, this will help speed up your recovery. We'll get you back to work in 3 to 4 weeks as a farrier, or in 4 weeks or so as a farrier, when in many cases it's weeks to get rid of the inflammation, to really get the therapy to start, the physical therapy to start to work, to get the healing process moving along. So let the success drive your customers. If somebody says, I don't believe it, and my vet says no, and I'm not going to talk to you, move on. Because there's plenty of people that will appreciate feeling better and what will happen with their health and wellness, or their pet's health and wellness, and feel better. But if they're steadfast, leave them alone. The results of something that works will bring them around at some point in time. I've had trainers. I can think of a couple of them right here. I don't want to mention any names, but they were great friends of mine, and I sold them stuff since 2002, or I've talked to them about things since 2002. But when I got into this, they just thought, "You're crazy. I'm not going to do that." All of a sudden, I find out 2 weeks ago that this guy's had a machine for a year. Didn't even know he bought one, and he's had it for a year. And this is one of the folks that would never talk to me. But sooner or later, they see what it'll do, and they'll come around. So that's my advice for you in that regard. Just that's how I'd respond. I'd tell them you've got the stuff. I'd give them some literature, and I'd move on. Be positive. If you cower and you, oh my gosh, I'm not sure it'll work, then that just supports what they're thinking. It does work. It will work. Just use it, and people will find it, and people will want you to do it. Okay, let's see here. That's the same question. Let me get rid of that. So, Karen, there we go. Let's look here. All right. Thanks. On a 14-pound dog with a disc issue, how to proceed, time and intensity. Okay. 2 points here. A lot of times people think, well, you do a horse and you can turn it up a lot higher, and I'm going to do this dog, so I got to turn it way down. And that's not necessarily the case at all. I'm not saying you're going to turn it all the way up on a dog, and you certainly don't turn it all the way up on a horse either. Typically, when you're treating a horse, you might turn it up more if you're treating the foot or the knee, but when you're doing the back, you're very moderate in your settings most of the time. So on a dog with a disc problem, typically I would lay the dog, 14-pound dog. You could certainly have the dog lay down, put the coil over its back, maybe like a hot dog, elongating the coil, let it run down the spine of the dog, and I would do it on a moderate setting. You might see some movement in the back of the dog as you're treating it, just like you would if you put it on your back. You would feel it pulsing, and I would take it to the comfort, and you look at the dog's eye. You can tell if the dog is comfortable. If it's too much, he'll get up and walk away, or he'll squirm. He won't like it. So just turn it up a little bit. As long as his eye is good and he's comfortable and allowing you to provide it, do it. Length of time, say like it's no different on a dog than it is on anybody else. 8 to 10 minutes, 8 to 12 minutes, any more than 15 minutes on that particular spot is more than enough, so that it's overkill. If you're going longer than 15, you can go 20 minutes if it's feeling good and relaxed, but you've achieved your effect in 12 to 15 minutes for what you're doing. How often? You could do it, if you did it today and the dog was good 4 or 5 days and it starts backing up, do it every 5 days. As we always say, provide the treatments as long as function continues to improve. And if you reach a plateau, provide the treatment as often as necessary to maintain the plateau. So that could be once a month, that could be once a week, it could be never. Once you hit the plateau, the dog may be fine until you do something. That's the way people are. People go out and they're fine, and all of a sudden they go out and work in the yard, or they go out and go on a run or get on a bike ride or something and twist themselves, and bingo, they're right back. Got to treat them a few times and they're good to go. So that's how that particular type of situation works. So Laura, great question. I hope that helps. Let's see. Stacy, let me see here. Pull this question up. Okay, I wanted to get my FEI card to work on our local CDI next year. In the new ruling, FEI states that the equipment must be a certain level to be legal. How do I show on the max machine what level I'm working at if asked to prove? Well, Stacy, that's a great question. And time is going to tell how the FEI and the CDI come around on their, I don't mean come around, but how they enforce the ruling that they've made. The ruling states that a PEMF device, a PEMF magnetic therapy machine, cannot be stronger produce a signal stronger than 1,000 gauss. And the MagnaWave Max machine, other machines on the market that are high voltage, low frequency, or high power machines produce more than 1,000 gauss with most of their attachments. Can you turn them down to where they are producing no more than 1,000 gauss? Yes. Will they allow that in the long term to be used? Because they're part of their challenge in FEI is they want everybody to be equal. So if they can't see you treating, you may say, well, I'm only going to turn it to this level and go back there and treat those horses. But they don't know that you don't go back there and turn it up and treat at a higher level, which they don't want you to do. We have whole discussions about that that's not necessarily the case, but they have said 1,000 gauss. Now, we understand we have a device, the semi device with particular coils will fit their guideline perfectly. I have a video that shows that. I have a meter that shows. There's not many meters available to accurately measure our signal. And the reason for that is because the signal starts and stops. Most magnetometers are designed to read a signal that is continuous, that doesn't stop, so they can get an accurate measurement of what's going on. But with high power devices that start and stop, it's very difficult to accurately measure the signal. We have a device that'll do that. In fact, here I've got it sitting right here. It's a little meter it's got a little coil on it that we can put up on the particular coil and accurately measure the gauss that's presented. Now, you can go to the store and buy a magnetometer, and you can hold it on your machine and put it up next to your coil, and it'll give you a reading. And I understand that people have done that, and they don't really know what they're reading necessarily on the numbers. But if it says 1,000 on that Gauss meter, FEI's been allowing machines in. So you can buy a magnetometer, see how it operates, put it on the machine, and see what it'll do. My feeling is that sooner or later, the FEI and the CDI folks are going to say, these devices produce more than we want. These devices are acceptable to what we want to deliver. So how that's going to play out, hope I'm answering your question okay. How that's going to play out will be interesting to see. So a magnetometer will show, so if you wanted to mark your machine at where it does not go over 1,000 Gauss and use it and take them and show that where you're going to do it and invite them to come watch you do it or invite them to visit you while you're in the stall to make sure that you don't go over those settings would be the way to approach that. And currently that's what is happening. So that's how I would approach that. Great question, Stacy, and I appreciate that very much. Okay, let's see here if got another one here. Aaron's on the line with us. Good morning, Aaron. Thanks for being here. Let's see. Laura, thanks. Serene Coley Doyle. Good morning. Okay, let's see. Here we go. Let's take a look at this one. Stifle issues. Treat inside, outside, or both, and how long is ideal? You answered your question. Treat inside and outside. Is it necessary to do both? No. I mean, you could treat the outside of the stifle and you're fine because you're going through. However, we have often maintained and long maintained in our training that if you approach the tissue from different directions at different intensities, the tissue is more responsive. So you might treat the outside at a moderate setting that's comfortable to the animal and you're getting movement or whatever, and then when you drift over to the inside, you may change the dial a little bit. It's just a little different frequency of delivery coming into that area, and that would enhance what you're doing. Do you have to do that every time? No. You could treat the outside at this setting, slide it around, treat the inside at the same setting, and go on. Tomorrow, if you treat it, you could change the setting a little bit. What happens, and what we've often known, is if you take a coil and you put it on the stifle, and you do it every day, and you do it at the exact same setting, and you put the coil in the same place and don't move it around, there's over a period of time, the horse will become used to what you're doing, and they'll slough it off. And then, you're not going to get the result that you're looking for. So, inside, outside, how long? Again, 8 to 10 minutes on that area. Actually, 4 to 5 minutes is an ample time on any one area if you want to focus on that area. If the stifle's there and you're going to treat all up around it and go over the stifle and be on it for a minute or so, you're fine in total. So, but if you've got a stifle issue, for sure, and you want to treat it, you treat it on the outside, treat it on the inside, 8 to 10 minutes, you're good to go. Change your frequency, change your direction, and you've committed a good protocol and should get the results that you're looking for. Great question, Leanne. Thank you very much. Let's see. Well, there's everybody's looking good there. Okay. Any other questions? There is one other question. Let me bring it up here. And the question I was asked yesterday: who is the NASA scientist that created MagnaWave? Well, the NASA scientist that they're asking about would be probably Dr. Bob Dennis. Dr. Dennis holds the patent on the results and what was used to design the NASA study that a lot of people refer to. Most everybody in the business that's doing PEMF equipment bases a lot of what they say on the NASA study. And the NASA study basically showed that it works. It can serve to regenerate tissue. It can serve to better oxygenate, thereby take care of inflammation and that whole type of thing. So that Dr. Bob Dennis is who they're talking about. But Dr. Bob Dennis did not create MagnaWave as such. He did not create PEMF. He simply applied the principles to PEMF to a particular study that was done at NASA. But when you go back to where PEMF came from, you're talking about Nikola Tesla and other people many 100 years ago or so that actually did put this together, created the magnetic field, showed that it had potentiality in the area of health and wellness, showed that it had other, the electric motor and all types of things, and how much stuff depends on electromagnetic fields to operate. In fact, one of the most recent FDA approvals for PEMF is it's called the Optune, and it's used for brain tumors. They're using it to shrink and to potentially help kill the brain tumors of glioblastoma that occur in the brain. And it's like a stocking cap that they put on that's got a bunch of coils in it, and then they wear it 8 to 10 or 24 hours a day. They wear this thing to be putting these magnetic fields into the area to hopefully, and I guess it varies from person to person depending on a lot of variables, but hopefully reduce the tumors, control them, kill them, along with everything else that they're doing. It poses a good question to me when they do go to the Optune. Are they doing that in the cases that I'm familiar with? They do it after chemo, just like we talk about doing, or if you're going to treat somebody for pain or something. So, but those are the questions with regard to Bob Dennis. Or the NASA scientist that a lot of times people talk about. Bob Dennis will be at our MagnaCon, or will be speaking with us at our MagnaCon event this year. It's in June 13th, 14th, and 15th. If you haven't made your arrangements and you'd like to come join us, it's going to be a great time, a lot of fun, tremendous 2 days of education to learn more about MagnaWave, human doctors, chiropractors, small animal veterinarians, large animal veterinarians, frequency doctors who study frequency delivery, and sound frequencies and the whole 9 yards. We'll be doing a lot there. You can see the machines. If you've not been around the machines, make your arrangements for MagnaCon. Go to the MagnaWave PEMF website, MagnaWavePEMF.com. Click the button, come join us, and I think you'll have a great time at MagnaCon. Let's see. Anything else? Let me go down here to the bottom. Okay, let's see. Here's another question. I understand the comparison of the semi on high to the other machines. Please compare the low setting of the semi to the others. Well, good question, Sandy. The low setting on the semi would be like the very lowest setting on the max. And it's basically now the semi operates differently than the max, in that the semi delivers 2 signals at one time. On our device, the semi device, it looks just like some other devices, but our semi has a low, medium, and high. Other devices that look the same only have low and high. Their low signal, you can't feel it at all, and you don't hear it unless you use a special clicker that'll pick it up and show you that it's there. What happens with our low is that you have this low, you might call it the Schumann resonance, or a very low signal going in the background. And one of the things that Bob Dennis found in the NASA study is that the higher power signals, like our signals, serve to very quickly relieve inflammation, very quickly improve your blood flow, and enhance the healing process. The low signal helps support that, and he felt you get a little better healing capability at that point once the inflammation is reduced. The challenge there is most of the low-power devices are designed to be used for hours. You lay on it, or you sit on it for an hour or 2 hours or whatever to get the result from the low signal. It takes, if you were to make a comparison, our high-power device will do in 10 minutes what some of the low-power devices will do in 2 weeks. So you want the pain, what everybody wants is instant gratification or instant results to get rid of their pain and inflammation and feel better. But with our semi, you get 2 signals at one time. You get the low signal, and then you get a click, click, click. That's the higher voltage or more powerful signal that will serve to help drive that oxygenation up and inflammation down. And so, so the low is very much like the low, as low as you could turn down the max, except that it's got that pulsing going, and it varies. I'm trying to think what it is. The medium is 70% of the high on the semi, and the low is 40% of the high on the semi. So you get 40% of the high signal on low, 70% of the high signal on medium, and 100% of the high signal when you're on the high setting on the semi, with that underlying second signal going all the time while the process is happening. So the low is low. I don't know how else to explain that. I hope that was clear enough, Sandy, to help you out. Great question. I got a chance to answer that for the semi devices, how they are powered. And again, the MagnaWave devices exclusive to MagnaWave, low, medium, and high on the semi machine. And of course, each variance of whichever coil you're using and how that deals with what you're treating. All right, let's see here. Leanne has a question. Pull it up here so we can see it. Pregnant mare. Okay to treat the feet only. Okay, as we always talk about, you ask a veterinarian, they're going to tell you, or a doc, they're going to say, well, you shouldn't treat pregnant mares or treat women who are pregnant or animals, dogs, and so forth. However, we've had situations, common sense comes into play here, and if you talk to your vet, the same thing. If you have a horse that's going to founder, and treating its feet a mare from foundering, because you don't want to lose the mare and the foal. So common sense certainly is the way to apply it. Okay to treat the feet only. I would say yes, but I'd say make sure your vet understands. There's nothing going on with this signal that's going to harm the foal. Now, but we do know that the signal causes contraction of the muscle. We don't want to certainly treat over the area of the foal. And we wouldn't say that. Don't do it. The vets are going to tell you not to do it. But again, talk to them. If you got a knee problem or you're going to get laminitis or you're going to get something going on and this is a way to treat it, would they do a massage? Probably so. Would they do some moderate vibration or ultrasound on the feet during this time? Probably so. So you got to talk to your vet. Great question, Leanna. Hope that was helpful. In my estimation, I talked to the vet, but can you treat the feet? Have we done that? Have people done that on pregnant mares? Absolutely. But you just have to make sure that everybody understands what's going on and that it is contraindicated as a treatment to the full body of the animal for sure. Don't do it. Make sure you talk to the vets. Okay, let's see. I think I've answered all the questions that are there. We've been here for that last half hour has flown by. I certainly appreciate your questions. I'm glad that you have been able to join us. If you have questions, drop me a line. It's Pat Zemer at Magna Wave PEMF. Send me a message on Facebook or send it to call Aaron here at the office. A lot of times Aaron can answer your questions right there on the spot, but we certainly want to help you in that regard. One thing I talked about at the very beginning, what people have asked me, and this is a question I got it last evening. What do you think sets MagnaWave apart from other companies? And anybody offering this, if their machines are okay, the machines are all doing about the same thing. What makes the difference in my mind is its depth and quality. And that can be depth and quality of machines or depth and quality of people. Right here in our office today, as I'm sitting here, the people in the office that are equine related or human treatment related, we've got 50, 60 years of experience. When you go into our pool of practitioners, well over 500 practitioners that are active in our private area to answer questions, we got hundreds of years of experience. So we have good depth of what's going on. Depth from doctors, depth from chiropractors, depth from acupuncturists, depth from massage therapists, depth from MagnaWave practitioners to help you get your questions answered about the type of treatment that you're looking for, the type of health and wellness that you're looking for, and then quality being the quality of these people to answer your questions. We want to be transparent, just like I try to answer. I didn't look at the questions before I pulled them up on the screen. I try to answer the questions directly as they're presented. So to me, it's depth and quality. Depth of number of machines. We've got machines that start at $6,000, $6,500. There's even a couple smaller machines in the $500 and in the $3,000 area for various applications, all the way up to the most expensive machines in the $20,000s of dollars. We got digital machines in all price ranges. Some people don't have that. So we got great depth on the type of machine, and the machines are warranties longer than most companies. And we're here to always make sure that you get the service that you want. Sorry for the commercial there a little bit, but that's what we think sets us apart, is to try to be transparent and to try to answer the questions that people have and to be here. I've been doing this since 2002. We're not going anywhere. My daughter's here, my son's here to help out, and they're going to be here. And so we just want to be very thorough in the services that we provide. And we've got another 11 employees here at the facility to better take care of the needs, marketing needs, service needs, whatever it is that you're looking for when it comes to MagnaWave and PEMF therapy. We believe it's the wave of the future in health and wellness, and we're excited about that. So anyway, thank you for being with me. I have another meeting I need to go to, so we look forward to being back with you next week. And until that time, have a great week, wave on, and take care of your health and wellness. Thanks a lot. Bye-bye.